So as you have been told, I'm an epidemiologist, and I'm going to tell you what I think about COVID-19, which is a little bit unusual because I'm not an infectious disease epidemiologist. I normally study neurodegenerative diseases of aging, but here we are. Okay, let me get my pointer. Okay, so what is my authority to speak about these issues? So who am I? You haven't seen me before. As Dr. Jicha mentioned, I'm usually behind the scenes, but I've been at Sanders Brown since 2006. I am known and trusted by the center staff and faculty. I teach epidemiology research methods to graduate students, and I actually noticed that one of my former students, Dr. Zhang, is on the webinar with us today. And I have no financial interest in anything that I'm telling you. I'm telling you these things because I think it's important for you to know them. I know that I'm not going to have enough time to talk about everything that I would like to talk about with you, and I'm going to strive to leave time for questions, but it's certainly possible that I won't. I am on Facebook talking exclusively about the pandemic and providing information for people who are interested. And so everyone is welcome to friend or follow me there on Facebook. If you go into Facebook and search for Erin Abner, this is me, the green circle and the UK shoes in the profile. So again, everyone's welcome to join me there and ask any questions that you have. So as you've already heard, if we're going to stay safe from COVID-19, remaining healthy at home here in Kentucky, as much as you can is your best strategy. Get tested whenever you have an opportunity. We actually have enough capacity here in Kentucky now for people who don't have symptoms to get tested, and I just did it myself on last Wednesday. It was very easy to do. It wasn't super uncomfortable, even though it was a nasal swab. So there's nothing to be afraid of. Just go ahead and get tested. We need to know where the asymptomatic infections are. When you are out in public, please do wear a mask to keep others safe. I'll talk a little bit more about that later. And of course, wash your hands for 20 seconds and don't touch your face. So my approach to this talk today is going to address some of the questions that come up or have come up most often on Facebook or have gotten the most engagement. So as we all know, there's this push to reopen the economy, states and nationally. Is it safe to go out? So the truth is it's not completely safe for anyone to go out. Governor Beshear and Dr. Stack have strongly urged Kentuckians over the age of 65 and those with compromised immune systems or in at-risk categories, including anyone with heart, lung, and kidney complications, to remain healthy at home because going out in public is not safe. So what does that actually mean in practice? So we've known about the virus only for a few months, but we've had some time now to do what we call contact tracing studies. So they'll find cases and then they will follow up with all of their contacts to see who got infected out of all the people that they knew. And so based on those kinds of studies, what we're seeing is most transmission is occurring in settings with close and what we call prolonged contact, but I'll talk a little bit about that in a minute. And so this is going to be within your household, right? If someone in your household gets infected and brings that into the household, others are likely to get infected. In schools, right? Indoor spaces where there's lots of people who are talking to each other, schools, apartment buildings, care facilities, shelters, jails, prisons, all of these places. Close and prolonged contact can occur. And in public transportation, airplanes, trains, cars with other people, all those kinds of things. So our best evidence right now says that we should avoid crowded indoor spaces, like restaurants, for instance, if those start to reopen. And if we are going to be in a setting where there is more than a few people inside, we should try to figure out ways to increase the ventilation in those spaces. Open the windows, open the door, turn on a fan. The big caveat here with this idea that transmission occurs most often with close and prolonged contact is that this is where we expect people to be. So this is a little bit maybe like saying 40% of all, sick days occur on Monday and Friday, which may sound like people are taking 4-day weekends that they aren't entitled to, but it actually just means that Monday and Friday account for 40% of the 5 days of the week. So we don't know, we haven't known about this long enough, but it does seem that there's a higher risk inside compared to outside. I've included some poll questions, and I'm hoping that Dr. Bardock can post them. Oh, here we go. So I'm seeing the screen. So imagine that 5% of the people in your community are currently carrying SARS-CoV-2, the virus that causes COVID-19, and are contagious. You go out to do some errands, shopping, etc., get gas, and you come within 6 feet of 10 people at some point. What is the probability at least one of those 10 people is carrying SARS-CoV-2? I'll submit my answer even though I know it. And I don't know how we see the results of the questions.
Their answers are still coming in quite rapidly.
I see.
So just giving it a moment, and then I think when I click end polling, we should see what people have said. It looks like we've got about 60 or so responses so far.
Right.
We have about 200 attendees on right now, so I'm just going to give it another 30 seconds or so if you want to put in your responses.
Thank you, Dr. Bardock. Okay, so thanks, Dr. Bardock. So now we can see the results. And so we have pretty even spread, and 40% actually turns out to be the answer. And so let's take a look at the math behind this phenomenon. Oops, sorry, click, okay. So it's easiest to start thinking about the probability that no people you meet might be contagious. So let's just pick a number for the percent of contagious people in the population. I'm not saying that 5% of people in Kentucky are contagious, but if they were, this means that each person you come across has a 5% chance of being infected or contagious. And since we can only be contagious or not contagious if we have a 5% chance of being contagious, then that means we have a 95% chance of being not contagious or not being contagious. So if we meet 10 people, what's the probability that all 10 of them are not contagious? And to get that number, we just calculate the product of all of the individual probabilities. So if all 10 of those people have a 95% probability of not being contagious, we just multiply all of those 0.95s together and we get 0.6. So the probability that 10 out of 10 people you meet, if 5% of the population is contagious, is about 60%. And so if it can only be the case that none of the 10 are infected or contagious, or at least one is infected or contagious, then that means the probability when we meet 10 people, at least one of those people is contagious, is 40%, which is a lot higher than we would seem to think, hearing that 5% of the population is contagious. So if 5% of the population is contagious and you meet 10 people, there's a 40% probability that at least one of those people is contagious. So I did this little table just to kind of show you, you hear from the public health officials and state guidelines about gatherings of 10, 20, 50 people. This is the math that's informing those group sizes. They're not just picking nice round numbers out of a hat. They're thinking, how likely is it if we get groups of this size together that at least one of those people is contagious? So if the true prevalence of contagious people in the population was only 2%. If you went to a church gathering, for instance, and there were at least 50 people there, even in that setting where just 2% of the population is contagious, in a group of 50 people, there's a 64% chance that at least one of those people is contagious. And if it were something not all that much higher, like 8%, if we were in a group of 50 people, there's a 98% chance that at least one of those people is contagious. So this is why Governor Bashir and Dr. Stack are saying it's not safe out because we know that there are people out there who are contagious, right? And there's far more of them now than there were before the shutdown occurred. So don't let your guard down. It's not safe. Wear your mask, don't touch your face, wash your hands. Time for the second question. Dr. Bardock, can you help us? All right, so what information do we need to know in order to interpret COVID-19 test results? We'll give us about a minute or so to answer the question.
Looks like we have about just over half of respondents, so I'll give you another 10 seconds or so if you want to get your answer in.
Thank you, Dr. Bardock. Okay, great. I'd love to see this. You guys are absolutely right. We need to know both the accuracy of the test and the true prevalence of the disease. And let's take a quick look at how that works. Sorry. So it's important to understand that medical tests all have some degree of uncertainty or error. They aren't the truth. The proportion of people known to have a disease and who test positive for the disease is called the test sensitivity. So that's a characteristic of the test. The proportion of people known not to have a disease and who test negative for the disease is called the test specificity, which again is a characteristic of the test. And although these are really important, they can only tell us about how a test performs in a population whose disease status is already known. They do not tell us the probability that a test performed on a person with unknown disease status is correct. This is called the test predictive value. And this is what we really want from a test, is for the results on people with unknown disease status to be correct. The probability of a positive result that is correct is called the positive predictive value, and the probability that a negative result is correct is called the negative predictive value. So let's say that we have a population of 10,000 people with unknown disease status that we want to test. And because this is a toy example, we know the truth, and the truth in this population is that 600 people are carrying the virus, SARS-CoV-2, so 6% prevalence. If the test has 99% sensitivity and 99% specificity, then the positive predictive value of the test is 86%, which is still good, but it's not 99%, right? So there's an 86% chance that a positive test in this scenario means that the disease is really there. So we can look at this, look at the math behind this, and this is where it comes from. 10,000 total tests, 600 people are true positives, 99% of 600 is 594, 99% of 9,400, the number of people who don't have the disease, is 9,306, and we can follow along down there. And so positive predictive value is, at the end of the day, is just the number of true positives over all the positive tests. So here, that's 86%. When diseases have low prevalence, like SARS-CoV-2 does now, even tests with very high sensitivity and specificity can return many false positive results. So we must be careful. Okay, one more poll question. Dr. Bardock, please help us. This question is about herd immunity, something you probably heard quite a bit. So what proportion of the population would need to be immune from COVID-19 in order to reach herd immunity? Let's take about a minute to answer.
Okay, we've got a little bit over half of respondents. We have a couple more seconds for those who want to get their answers in.
Okay, great. And again, you guys are right on it. So this is a little bit of a trick question because the answer is actually it depends on how transmissible the disease is. But based on what we know about SARS-CoV-2 now, we think that about 70% would achieve herd immunity, although I have seen estimates ranging from 20% to 90% given a bunch of different scenarios. So let's talk about why epidemiologists and public health officials are not more supportive of achieving herd immunity through infection. So, right, so this is the idea that I think that you understand that a new epidemic of a disease cannot get started because it cannot find enough susceptible host, excuse me. We can think of this as the point where each contagious person infects fewer than one other person on average. And this is really best achieved through vaccination and not infection. But let's take a look at this little graphic, which I don't think it's letting me show my movie. That's okay. So, but basically, if the situation that we're in with SARS-CoV-2 is this one, where we're all blue dots, we don't have any immunity against infection. So with one infected person and everyone else without immunity, the infection can spread all through this population. And with just 25% who are immune, the infection still spreads all through the population. With 50%, it still spreads all through the population. When we get to these figures down here with 75% immune, 90%, 95%, the people who are infectious are not able to find a susceptible host, and so the epidemic can't start. But ongoing epidemics don't stop when the threshold for herd immunity is reached. People keep getting infected from those people who are currently infectious at the time the threshold for herd immunity is met. So ongoing epidemics don't stop because of herd immunity. Only new epidemics are prevented via herd immunity. The other really big problem for public health and epidemiology here is that we don't know if or for how long people who recover from SARS-CoV-2 infection are immune, which that's a pretty critical assumption, is that they will be immune, and we just don't know. Right, let me skip this. Another thing that I'm seeing a lot these days are people worried about the effects that social distancing and wearing masks might have on our immune systems. And so people are afraid of this, but they don't need to worry. This is related to the idea that, you know, little children need to be exposed to all kinds of stuff so that they don't have a bunch of allergies when they're children and adults. It's called the Hygiene Hypothesis, and it's just a hypothesis and for children, but there's never been a theory that adults need to have their immune systems challenged over and over. And this is really because our bodies and our homes are already filled with microbes. And you know this already. You know you don't eat off the bathroom floor. You don't wash your hands in the toilet bowl, right? You know that there are germs in your house already. Plus, every time you go outside, you're exposed to new microbes. They get on your shoes, they get on your clothes, your groceries, bring them into your house. So you have lots of opportunities, even with wearing a mask and even with social distancing, to get exposed to things that can make you sick. And it turns out that a normal, healthy immune system is always hard at work. And just brushing your teeth would introduce enough harmful bacteria into your bloodstream to kill you if it wasn't. So no worries there. And thinking back about masks, so I can't tell you what the percent protection is from any of these scenarios. You know, we just don't know. So these things are all kind of based on common sense and some lab studies and observational data from other populations. But if we have somebody who is infectious but who is not obviously symptomatic, and we have this uninfected person who isn't wary and gets too close, if she's wearing a mask, the risk of transmission is still high, but perhaps a little bit lower if he, the infected person, is wearing a mask and she's not. Maybe lower than the scenario before, but still a good chance of transmission. If both people are wearing masks, we think that's a very much lower chance of transmission. And then if those people are also maintaining appropriate distance, the chance of transmission is very low. And of course, if we are healthy at home, there's no chance that we get infected from our neighbor. And again, I think we have a few minutes for questions this time, but you're welcome to join me on Facebook. I'm talking about COVID-19. I'm answering questions. I'm your friendly neighborhood epidemiologist. No one is made fun of or shamed for any question or any belief that they have.
Wonderful.
And
Thank
that's
you.
my profile.
Thank you, Dr. Abner. That was a wonderful presentation and lots of really, really great information.